Hello, my name is Dr. April Speed of Dr. Speed Global Breast Health and Wellness Center. Welcome to our video blog. I am reaching out to Cam29 today and all of our trusted and much appreciated viewers for a question that she posed regarding a bilateral prophylactic mastectomy. Now, I addressed what a bilateral prophylactic mastectomy is in past blogs, but just as a recap, bilateral prophylactic mastectomy is the removal of both breasts in the absence of disease. Many women that choose this option either have the breast cancer gene, namely BRCA1 or BRCA2, or have a family history of breast cancer. Her question was in regards to what are some of the changes to expect in the breast after undergoing a bilateral prophylactic mastectomy. Now, there are two types of changes. There are immediate changes and some long-term changes to expect. Now, in terms of the immediate changes, many women, regardless of whether or not it's done for prophylactic reasons, meaning in the absence of disease, or for therapeutic reasons, will have some similar changes in the breast. So one such change is breast swelling. 100% of patients should anticipate some swelling of the breast flap. So what remains is the skin and often the nipple of the breast, and there is some swelling, but oftentimes that swelling will go down with at least a week or two. Another change to expect is just the sensation of the nipple and also the skin will change after surgery. We see these changes immediately, but we also see, in terms of the final result, more in the long term in terms of what the breast will eventually end up experiencing. So I usually tell patients you kind of have to hurry up and wait to see what the final result will be in terms of the feeling that will be in the nipple and also the skin. Another immediate change is oftentimes there will be some fluid retention. We call that a seroma underneath the flap of the skin. So oftentimes your breast surgeon will leave drains in both breasts to collect the fluid. Usually, once the drainage is less than 20 to 30 milliliters in 24 hours, those drains will be removed in your surgeon's office. In terms of some long-term expectations regarding the breast after bilateral prophylactic mastectomy, again, will be in terms of what you will feel in the skin, the nipple. So the sensation is something to be mindful of in terms of changes in the breast. Oftentimes you'll have decreased sensation. In some women, there's increased sensation. In regards to the shape and contour of the breast, usually it will take its final form several months and even up to 1 year after you've had your primary surgery. And so in terms of the changes to expect in the breast, you will expect to have some changes in the contour. The inframammary fold, which is the fold at the bottom of the breast, that may change several months to 1 year down the line. Also, the cleavage line may change after swelling goes down. And also, depending on the type of reconstruction that one gets, be it with implants or if there's tissue-based reconstruction, oftentimes the contour will change after swelling goes down, drains are removed, after the breast will take on its final shape and form. But you have to be patient and give your breast at least 6 months to 9 months before you can get a good appreciation for your final result. In regards to any additional long-term changes in the breast, sometimes patients will note the feeling of scar tissue along the incision lines. That's completely normal, but over time the scar tissue will soften and become less noticeable. However, I always caution patients, even if you've had a bilateral prophylactic mastectomy, meaning in the absence of disease, it's important to keep your healthcare providers informed as to whether or not you feel any new lumps in the breast different from any scar tissue you may have felt in the past, because this could be a sign of breast cancer, a sign of recurrence in women that had breast cancer on the opposite side and they received a prophylactic mastectomy at the time of their index surgery, or it could be a presentation of new breast cancer, someone that never experienced breast cancer. Again, we don't see this very often, but it's still very important to keep your clinicians informed if you feel any new lumps in the breast and have those biopsied immediately and not just assume it is scar tissue, although again the post-surgical scar is the most likely diagnosis. I always caution patients that when you have a bilateral prophylactic mastectomy, that this does not completely exempt you from ever getting breast cancer in the future. Although there has been some data to show very promising results that in women that have a family history that have chosen to have a bilateral prophylactic mastectomy, that they saw a 91% reduction over a 15-year following in the incidence of breast cancer. So again, it can be very effective means of risk reduction in women that are at elevated risk. However, again, it's a very measured approach. It's a decision that takes the expertise of not only the breast surgeon, your plastic surgeon, your family, and also just patient desires and your individual medical and family history. So again, I hope this blog was helpful in answering Cam 29's question, and also any viewers out there that may have been curious about what to expect after a bilateral prophylactic mastectomy. Make sure you consult with a qualified board-certified plastic surgeon and also your breast surgeon. They'll coordinate to make sure you have an excellent result. And again, thank you for tuning in. I hope this blog was helpful, and please make sure you not only like us, but comment in the form of a question so we can get these questions to help save lives. And in all things, we're going to treat it, beat it, move on. And thank you so much for tuning in, and we're taking you from your breast health to your best health. Thank you.